you, Mrs. J, on those amazing great instructions on chapter 15 and coders. Now it's time for us, as Mrs. J said, to move on to chapter 16, newborn perinatal. So chapter 16 is all about the newborn perinatal guidelines, and this ICD code range from P00 to P96. So let's look into the guidelines of chapter 16. We have the guideline C16.A.2, principal diagnosis for the birth record. So when coding the birth episode in a newborn record, assign a code from category Z38. Yes, live-born infants, according to the place of birth and the type of delivery as principal diagnosis, and a code from Z38 is assigned only once to the newborn at the time of birth. So it's very important to note that use only on the newborn record, and this can be only used once. So one patient has only one once in a lifetime Z38 code in his chart. Okay, so let's move on to the next guideline. The guideline C16.A.6. So it says that all clinically significant conditions noted on a routine newborn examination should be coded. So you might ask what a clinically significant conditions are. So a condition is clinically significant if it requires a clinical evaluation or a therapeutic treatment or a diagnostic procedure or an extended length of hospital stay or increased nursing care and or monitoring or implication for future healthcare needs. So in short, we can say call them cited. So that's about guideline C16A6. Moving on to the next guideline, we have C16.A.6.B.1, observation and evaluation of newborns for suspected conditions not found. So the code Z05 should be used if the newborn is observed for a suspected condition that is not found, and they may also be assigned as a principal or first listed diagnosis when category Z38 is no longer applicable. So in the absence of the ICD code Z38, Z05 can be assigned as a principal or first listed diagnosis. Now it's time for us to do some ICD-10 flip exercise. And this is your question. Select the diagnosis codes for the newborn's record. Your options are option A, P59.9 Z38.00, option B R17080 Z37.0, option C P59.9, option D Z38.00 P59.9. A male newborn delivered vaginally in hospital is born with jaundice. Select the code for the newborn's record. And you got 2.5 minutes, so I'm sure you will be finishing it before that, and your time starts now. Okay, Chorus, I think most of you have got this one correct. And let me know, Chorus, how many of you have to really look up the ICD codes in the book to get this one correct? How many of you check your ICD books and search those codes? So the correct answer for this scenario is going to be option D. And the keywords is male, vaginally delivered, hospital, jaundice, newborn's record. Yes, so if you know the guidelines, you could easily solve this one. Not even by looking, not without even looking into the ICT book. I will say how. The guideline that is going to help us in this scenario is going to be before that. Okay, we are coding for a newborn's record. We are coding for a newborn who's born in a hospital and patient is diagnosed with the jaundice as well. So in option B, we have got R17 O80. O80 is never given on a newborn record, right? Mr. just went over those guidelines. O80 will not be assigned in a newborn's record. It will be assigned only in a mother's record. And the guideline C16.A.2, that is for principal diagnosis for birth record. Since we are coding for a newborn record, we have to assign Z38 as primary. Yes, if you knew that guideline, I can eliminate option A, I can eliminate option even B, option C also. And the correct answer is going to be option D, as most of you have said. It's going to be option D, which is coding for Z38.00. That is a single live born infant delivered vaginally. The baby was born in a hospital. Yes. And P59.9, which is coding for neonatal jaundice. Yes. So the correct answer is option D, and you all have done great job in this scenario. So let's move on to the next one. Your options are option A R63.6, option B P92.9, option C P92.01, option D P76.0. Assign the codes for feeding problems in a newborn. And coders, your time begins now. Okay, coders. So you all are rocking in the chat. This was a pretty straightforward one, right? So the correct answer is going to be option B. We are coding for feeding problems in newborn. And let's look into these options. We have option A R63.6. That's coding for an underweight. That's not matching our keywords here. We are coding for a feeding problem in newborn. R63.6 is wrong. And we have option B, which is coding for, okay, option D, that is coding for P76.0, that is for meconium plug syndrome, and that is also not what we are looking here. We have option C, that is coding for P92.01, that is for a bilious vomiting of newborn. No, the patient didn't have that condition. Finally, we are left with option B, that is P92.9, which is exactly matching all the keywords that's coding for a feeding problem in newborn unspecified. Yes, good job. Good job. If you got it wrong, don't worry, you have learned something here. It's priceless. So don't get yourself down. Yes, great effort, great work. Okay, coders, with that, we are moving on to prematurity growth retardation. We have a guideline C16.D that states that the assignment of codes in the category P05 disorders of newborn related to the slow fetal growth and fetal malnutrition, and P07 disorders of newborn related to short gestation and low birth weight not elsewhere classified should be based on the recorded birth weight and estimated gestational age. Yes, the codes P05 and P07 are based upon the birth weight and estimated gestational age documented. When the both birth weight and gestational age are available, two codes from category should be assigned and sequence the birth weight before the gestational age. So you have to code the birth weight, that is for P07 first, followed by gestational age P05 when both are present, and these are assigned based solely on the recorded birth weight or gestational age. So with that, now it's time for us to move on to chapter 17, that is congenital malformation, deformation, and chromosomal abnormalities, and the code series range from Q00 to Q99. Yes. So congenital malformations, deformations, and chromosomal abnormalities are those which is present at the birth and may be genetic. So those conditions that are present at the birth are falls under these categories. When documented, a condition from chapter 17 may be first or secondary diagnosis. The codes from chapter 17 may be used throughout the life of the patient, and if the condition has been corrected, use appropriate personal history code. This diagnosis code does not have to be established at birth. So that's an important thing. This diagnosis does not be established at the birth. It can be also established at later stages of the patient's life. So you can see different kind of congenital malformations here in the image. We have encephaly, we have closed spina bifida. So these all are what we call congenital malformations or deformations, or it may be also due to chromosomal abnormalities as well. Okay, so let's do some ICD-10 flip exercise on chapter number 17. And this is your question. What are the codes? What are the correct ICD codes for the newborns chart? Option A is a 37.0, P00.0, P03.811, P05.08. Option B, you have Z38.01, P03.810, P05.9, P00.0. Option C is a 38.01, P03.811, P05.08, P00.0. Option D, Z37.0, P00.0, P03.810, P05.9. The mother at 39-week gestation arrives to the ED in labor with symptoms of headache, blurred vision, nausea, and vomiting. The ED physician diagnosed the patient with severe preeclampsia, called the patient's OB, then escorted the patients to the labor suite to prepare for delivery. The fetal heart rate had notable deceleration during the contraction. Upon arrival to the hospital, the OB confirmed that a cesarean section is necessary. A low transverse cesarean section was carried out. Upon delivery, the infant was noted to have growth retardation and was light for gestational age. The infant weighed 2000 grams with normal APGARS. That's a score. What are the correct ICD-10-CM codes for the newborn? And coders, you will have 2.5 minutes to solve this one. Your time begins now. Okay, coders, how are you doing? Let me quickly look into the chat. OMG, I can see some great answers in the chat. And you guys are even explaining why you eliminated those wrong answers and arrived at the correct answer. Excellent work. Great. Awesome. That's an awesome work over there. Yes, great coders. So the correct answer for this scenario is going to be option C. And we have a 39-week gestation mother. She is an ED in labor, headaches, blurred vision, nausea, and vomiting. The ED physician diagnosed the patient with severe preeclampsia and asked her to prepare for delivery. The fetal heart rate was notably decelerated during the contractions, and OB also the a law transverse C-section, that is a cesarean section, was carried out, and the weight was 2000 gram for the newborn infant. That's all we have in the keywords. And what I do for these scenarios is I would read the last portion of the question so that I get clear idea for whom I am coding for. So the question is, what are the correct ICD-10-CM codes for a newborn chart? So it's clear that we are coding for a newborn baby and we are coding for the newborn chart. That means the guideline C16.8.2 comes into my mind, which is for principal diagnosis for the birth record, and that states Z38 should be assigned as a principal diagnosis on a newborn chart. Right, Curtis? Yes, you said it in the chat. Excellent. That means option A and option D both are incorrect because they are not having Z38 in their primary or first listed diagnosis. Yes, option A and option D is coding for Z37.0. That is for a single live birth. That's an outcome of delivery. And the outcome of delivery is coded on a mother's chart or a mother's record. And we are here coding for a newborn chart, right? That eliminates option A, option D. Now we have to decide between option B and option C. So they are both coding for Z38.01, which is for a newborn baby code. That is for a single live born infant delivered by cesarean. Exactly, that's what happened in our scenario. We had a baby delivered by cesarean section. So Z38.01 is correct. Now let's look into P00.0, which is for a newborn affected by a maternal condition. Yes, in our scenario, newborn was affected by a maternal condition. And P00.0 is for newborn affected by maternal hypertensive disorders. And it says that a newborn affected by maternal conditions classifiable to O10 to O11 and between O13 to O16 are all included in this code, in the code P00.0. So we had mother suffering from a severe preeclampsia, and the ICD code for severe preeclampsia is O14.1, and that falls between O13 to O16, right? So yes, this is the correct answer. P00.0 is the correct answer. But the instructional note or instructional guideline asks us to code first any current conditions in the newborn. So before coding P00.0, we have to code the conditions that are present in the newborn. So let's look into the next set of codes. So in option B and option D, both are coding for P03.810 and P03.811 respectively. So let's look what these codes are. P03.810 is coding for a newborn affected by a abnormality in fetal heart rate or rhythm before the onset of labor, and P03.811 is coding for a newborn affected by abnormality in fetal heart rate or rhythm during the labor. So both are differing in those last terms. P03.810 is for before the onset of labor, and P03.811 is during the labor, right? Now let's go back to our documentation and see what is in there. So we have a fetal heart rate that was shown a deceleration during the contraction. So during the contraction means that's during the labor, right, coders? Am I correct? Are you following me? Yes, that means exactly that's during the labor. So which means option P, that is coding for P03.810, is incorrect. And we can eliminate option B, and our correct answer is going to be option C. So let's also look at what P05.08 coding for. That is coding for newborn, right? For gestational age for 2000 to 2499 grams, and our baby weight was 2000 grams. So that is also a great code selection. And the correct answer is going to be set 38.01, P03.811, P05.08, and P00.0. And that is our answer. How are you doing, coders? Let us know in the chat. How are you feeling? Did the explanation help? Good, great, awesome. All coming up in the chat. Yes, so we have got one more scenario, one last scenario for the day. And here's your question. Select the codes for the infant's record. Option A Q97.1, option B Q90.9, option C Z38.00 Q90.9, option D Q90.9 Z38.00. The hospital documentation states normal vaginal delivery, live birth, female with Down syndrome. Select the code for the infant's record. So coders, your time starts now. What a way to end the final question. Excellent, excellent coders. Excellent work. The correct answer for this last question is going to be option C. And we have a normal vaginal delivery, live birth, female with Down syndrome, and we are going to go for an infant's record, right? You guys captured that guideline very well. I can see placing answers in the chat along with the guideline. Excellent work, coders. So, as you all said, we are going to code for a live born infant, and the guideline says upon delivery, code according to the place of birth and type of the delivery first, then the congenital defect. The guideline is C17. So first we have to code Z38 followed by the codes from the code series Q00 to Q99. That's for congenital defects. And we had a Down syndrome in this scenario, right? Okay, let's now look into option A. So with the guideline, I don't need to look into the options, right? I can eliminate option A because that's not coding for Z38 initially. That should be Z38 should be our principal diagnosis. So option A, I don't need to look into that. It's wrong. Option B also is wrong. Option D is also incorrect. Yes, that is also incorrect because that's not following the sequencing guideline. And Z38.00 is for single live born infant delivered vaginally, and Q90.9 is for Down syndrome unspecified. So if you look into the note under Z38, you can see this category is for use as principal code in the initial newborn baby. So that means that 38 should be used primary as a primary or first listed diagnosis, which eliminates option D because of wrong sequencing order. The correct answer is option C, Z38.00 Q90.9. So coders, if you are feeling behind, remember not everyone is running the same race. We have different start positions, different weights to carry, different race track, and different goal. You're not behind, you are on own unique path. So well done, coders. With that, we wrap up the week 7 class. Don't forget to leave us the feedback, our survey, why the feedback is important. It helps AMCI deliver quality class, helps your instructor help you. No feedback means no good. So remember to fill up the survey. And thank you for joining us for the week 7. Thank you, Mrs. J, for those amazing instructions. And thank you, Miss Stephanie, for rocking the chat. Thank you, coders, for joining us. Grow positive thoughts. See you all next week for the final week for part 2, week 8. Till then, stay safe and keep coding. Goodbye, coders. Have a nice day.
Thanks for tuning in, and until next time, happy coding!